50 years ago, Dr. Dennis Burkitt, famous for Burkitt's lymphoma, talked of an analogy where the sink is running and the sink is running and the sink is overflowing and everybody's mopping up to control it. Nobody thinks about turning off the sink. Dr. Dean Ornish has used that example in his lectures, and I'll use it in mine. Functional medicine, the evolution of cardiology, has got to go to looking at why is the sink overflowing and turning off the root causes and the root sources. So we've become a specialty of cardiology that has distanced ourselves from patients, has distanced ourselves from simple solutions and root causes. And what James talked about, 80 to 90% proven scientific ability to prevent that heart attack, to prevent that stroke, is something we've just not capitalized on, and something that I've dedicated a lot of energy, and I'll speak about that. So we have this great heritage in medicine and cardiology going back 1,000 years to the famous physician and caliphate advisor Maimonides. No disease that can be treated by diet should be treated with any other means. The founder of the Mayo Clinic. The aim of medicine is to prevent disease and prolong life. The ideal of medicine is to eliminate the need of a physician. And I ask you to predict, how old is this quote? A heart attack after age 80 is an act of God or God's will, but a heart attack before age 80 is a medical failure. Now that might sound like a very current quote. And heart attack before age 80, a Bob Harper, a Carrie Fisher, a Bill Paxton, a James Gandolfino is a medical failure, which I believe very strongly. It's a complete breakdown of the technology we have. That was said by Paul Dudley White, who was chief of cardiology at Harvard, who was President Eisenhower's physician, was said in 1955. And the picture in the middle is Dr. Dudley White in a tie in Italy with the famous Dr. Ansel Keys, because they knew early on your food choice, your fitness choice, your love choice, and your sleep choice made tremendous differences in your health. But somewhere we lost our way, and we became, in my field, very high-tech, and high-tech started to replace high-touch. So two pioneers to your left in the white jacket is Dr. Mason Sones, who accidentally discovered you can put a catheter in a heart artery, you can inject dye, and the patient doesn't die themselves. So we started a field of technology in coronary angiography. Very important, but the patient was draped. And I remember in 10 to 15,000 catheterizations I did, my patient was that big. That was the little hole in the drape that I dealt with. Next to him is Dr. Rene Favolaro, giving him a hug, the first physician at the Cleveland Clinic and around the world to do a bypass operation. They're wonderful physicians, and to the right is Dr. Andreas Grunzig from Zurich, moved to Emory University, the first angioplasty, first in legs, then in human hearts, found out people didn't die when you put a balloon in their heart arteries. Incredible breakthroughs in technology, but the beginning of separating the physician and the patient, the healthcare provider and the patient, that has removed the focus on the human nature of medicine to some degree. And few have said it better than the famous Dr. Mehmet Oz. What we have now is doctors who are actually better technically than what they're doing than their specialty in 30 to 40 years. But we lost the relationship when doctors would look people in the eye, because now we look at laptops, and say, I care about you. We can do this together. We can beat this problem. And the question is, how can we use multiple modalities and community and all that we're going to talk about today to bring back that eye-to-eye contact with a patient? Let them know we care about them, let them know we love them.